Hi, my name is Deborah Dawson. I'm the chair of the Economic Justice and Labor Committee of the Tompkins County Progressives. This is a PowerPoint presentation that I did for the Lansing Democratic Committee on April 3rd, 2017, very shortly after the Republicans in Congress failed to get a sufficient number of their congressmen to vote for Paul Ryan's AHCA. There was a lot of interest in what was going to happen next with health care, and that is what this presentation is all about. So let's talk about where we were as the Great Recession started back in 2008. We had 45 million people on Medicare, which is a federal program funded by a special tax dedicated to the purpose that covers everyone age 65 and older, as well as several million younger but severely disabled people. We also had about 48 million people on Medicaid, which is a heavily federally subsidized program that is administered by the states. The states set their own eligibility standards. It covers most people living at or below 100% of the federal poverty level, especially those with children. Children are covered through the Children's Health Insurance Program. Then we had 98 million households that were covered through employer-provided health insurance. According to the U.S. Census Bureau, there are a couple of disturbing trends in the employer coverage group. The number of employers offering health coverage dropped by almost 6% between 1997 and 2010. And the number of people actually getting coverage through their employers dropped by almost 10% during the same period. Over half of the people who were offered coverage through their employer chose not to take it. The number one reason being that they had coverage through another family member's employer. But an increasing percentage of people who chose not to take insurance through their employer, over 25% of them in 2010, chose not to take it because it was too expensive for them to pay their share. Other statistics show that the likelihood that your employer will even offer health coverage increases dramatically with your education and income level. So, if you have only a high school education, and you're earning, say, $30,000 a year, you're not likely to even be offered insurance through your employment. These trends are really problematic because not having employer health insurance and not being eligible for Medicare or Medicaid pushes you down into the private individual health insurance market. 14 million households buy their health insurance on that market. Since 1945, the McCarran-Ferguson Act has put regulation and control of the private individual insurance market under state regulation. That means that they regulate every aspect of the health insurance that are offered to their residents. This kind of makes shopping in the individual market a lot like reaching into Forrest Gump's box of chocolates. Particularly if you're a shopper driven by price point, you could end up with a cheap policy, but it won't cover much. That left 50 million households that were uninsured. Who are these people? In 2008, the Census Bureau reported that 62% of uninsured Americans earned $50,000 a year or less. Some of them were young and healthy and decided they didn't need insurance. Some of them were uninsurable due to pre-existing conditions. Some of them might have been eligible for Medicare or Medicaid, but many were not. Many of them were employed, at least part-time. Some of them might have been able to afford a minimal private policy, but a substantial percentage of them needed financial assistance in order to afford any kind of health insurance coverage. So how did the ACA, the Affordable Care Act, change this status quo? The ACA aimed to make health care more widely accessible by making health insurance coverage more affordable. The ACA expanded coverage in two ways. First, it provided federal funding to any state that expanded its Medicaid eligibility to include adults under 65 who had no children in their homes and whose income was between 100 and 138% of the federal poverty level. This was called the Federal Medicaid Expansion Provision. This provision also provided funding for an expansion of the CHIP program to cover children of families in the 100 to 138% demographic. And this Medicaid and CHIP expansion alone allowed 12.3 million previously uninsured Americans to start receiving Medicaid. Secondly, the ACA provided health insurance premium subsidies to individuals and families whose income was between 100 and 400% of the federal poverty level. These subsidies have the practical effect of capping premiums at a low and affordable percentage of household income, a percentage that increases as household income goes up. And the ACA subsidies are key to the premiums for insurance plans with relatively low deductibles and copays. And that has the effect of further reducing out-of-pocket health care costs for families who qualify. As a frame of reference, let's look at those federal poverty levels for 2017. So here are the federal poverty levels for 2017. 100%, 138%, 250%, and 400%. I was surprised to notice how high some of them were, especially as your family gets bigger. In 2017, the ACA subsidized premiums in excess of 2.04% of income for households below the 138% level. Premiums in excess of 8.21% at the 250% level. And premiums in excess of 9.69% at the 400% level. Since the ACA passed, 9 million Americans who previously couldn't afford health insurance signed up for subsidized insurance coverage on the ACA exchanges. So these provisions certainly helped folks who couldn't afford health insurance before. But the ACA also had some goodies for the rest of us. And here they are. The ACA prohibits pre-existing condition exclusions, lifetime or unreasonable annual limits on coverage, policies that don't cover a set of essential benefits and preventive care. It requires that dependents be covered to the age of 26. This provision by itself allowed almost 1.5 million young adults who had previously had no insurance to be covered under their parents' policies. The ACA eliminated premium differentials for women, age rating premiums in excess of 3-to-1, and by that I mean people over 55 generally pay some multiplier over the premium that younger people pay. Before the ACA, that multiplier was 5. So older people over 55, were paying as much as 5 times what people, say, 40 or 30 were paying. The ACA also limited the amount of copays and deductibles that a policy could charge. It guaranteed that your policy would be renewed regardless of actuarial experience, and it created tax credits for small businesses that offered employee health coverage. Of course, everyone knew that as a result of these changes, the cost of health insurance was going to go up under the ACA, because after all, insurers would have to start insuring really sick people and actually covering people's medical needs. So, to get the insurance companies' buy-in, the ACA promised to make them whole for any losses they sustained in any of the first 10 years after the Act was passed. At the end of each fiscal year, the insurance companies could document their losses, and the government would reimburse them out of specific ACA funds or out of general funds if the ACA funds were insufficient. The possibility that an insurer would lose money was referred to as a risk corridor, and the ACA explicitly guaranteed that those risk corridors would be reimbursed. Another benefit for the insurance companies was that the ACA imposed an individual mandate that required everyone to buy insurance or else pay an excise tax. The individual mandate was designed to get younger, healthier people into the insured pools, thereby improving the pool's actuarial experience and helping keep premiums down. And of course, it also created a class of additional customers for insurance companies. So now everybody's happy, right? People with pre-existing conditions are relieved and happy because they can finally qualify for insurance. Low-income people are happy because they can finally afford insurance. People who already have health insurance are happy because their insurance is better. And health insurers, I guess they're happy. They've got a lot more customers. Look, congressional Republicans are not happy. They are really not happy. And let's see why. In order to pay for the Medicaid expansion, the premium subsidies, the risk corridor reimbursements, and a significant boost to the Medicare fund, the ACA imposed new taxes. We've already mentioned the excise tax for ignoring the individual mandate, but there were more. There's an excise tax on large employers who don't offer adequate employee health care coverage. There's an excise tax on employer-provided Cadillac plans. There are excise taxes on health insurers and manufacturers and importers of pharmaceuticals and medical devices. There's an additional payroll tax and a new tax on net investment income on high-earning taxpayers. That would be individuals earning more than $200,000 a year and couples earning more than $250,000 a year. Interestingly enough, the CBO determined that these taxes would raise enough revenues to actually cover the cost of the ACA, extend Medicare funding, and reduce the deficit in 2020. But the Republican deficit hawks still hated the ACA, and we know this because they tried to repeal it more than 50 times. But while Congress distracted us by voting to repeal the ACA again and again, a small group of Republican senators, led by Marco Rubio, did manage to sabotage the ACA in December of 2015. In very simplistic terms, they managed to eliminate funding from general tax revenues for risk corridor reimbursement. When health insurers submitted their 2014 risk corridor requests for $2.9 billion, they learned that there was only $362 million available in an earmarked fund from which to pay them. Interestingly enough, Rubio proudly claimed that he had just saved the government $2.5 million. He argued that no money should come out of general tax funds to pay a private insurer for failing, because that would be crony capitalism. And we know that there's nothing a senator hates more than crony capitalism. So what happened next? The insurance companies were out $2.5 billion, and that had to be made up somehow. Nonprofit cooperatives that insured over 700,000 people just went out of business. Larger companies pulled out of smaller, less profitable markets. And everyone raised their premiums, a lot. And so was born the death spiral narrative, pushed by Republicans and this guy, Mark Bertolini, the CEO of Aetna. I have a couple of fun facts about Mr. Bertolini. Aetna compensated him to the tune of $27.9 million last year. This makes him the highest earning CEO among America's 5 largest health insurers. And one of the reasons why Aetna pays this guy so well is that he negotiated a major merger agreement between Aetna and Humana. Last summer, while that merger was pending, Aetna decided to pull out of all but 4 of the 15 state ACA exchanges on which it was selling individual health policies. Aetna's publicly stated reason for doing this was that it was losing way too much money on the Obamacare exchanges. However, In a recent opinion blocking the Aetna-Humana merger, a federal judge found that, in fact, Aetna had threatened to withdraw from the exchanges because the Justice Department wanted to block their merger. And it followed through on its threat as soon as the Department of Justice filed its lawsuit. Moreover, the judge found that Aetna's management and attorneys went to great lengths to conceal the fact of the threat from the court. What makes this particularly interesting is the fact that Aetna's withdrawal from the markets is one of the facts that has driven Paul Ryan's relentless messaging that Obamacare is collapsing and it's up to the new Republican leadership to rescue it. In fact, that was a purposely created fact to support a self-fulfilling prophecy that the ACA exchanges were failing. We'll talk more about this later, but right now, let's look at the congressional Republicans' latest attempt to repeal and replace the ACA, Paul Ryan's American Health Care Act, the AHCA. So let's see how the AHCA would have accomplished these goals. Well, it would have definitely eliminated mandates and regulations. And let's be clear here. When Paul Ryan was talking about eliminating mandates, what he was really saying was repealing provisions of the ACA. What mandates would have been repealed, and what would the effects have been? Well, the individual mandate would have been repealed. This would have allowed younger, healthier people to stay out of insurance pools, driving premiums up rather than down. And the employer mandate would have been repealed. By repealing the excise tax on employers who fail to offer adequate health coverage, and repealing tax credits for small businesses who offer adequate coverage, the AHCA would have removed any incentive for employers of all sizes to offer any coverage, thereby throwing their employees back in the individual market to buy their insurance. But let's look at how those individual market policies would have changed after the AHCA repealed a couple of significant ACA regulatory mandates, like the 3-to-1 limit on age rating plus premiums. What this would mean was that states could go back to allowing the old 5-to-1 age rating system for folks over 55. The Republicans in Congress argued that this would lower premiums for younger people, but it would definitely raise them for older folks. In fact, the AARP's research indicates that premiums for current coverage could increase by up to $3,200 a year for a 64-year-old, while the reduction in premiums for younger people might be only $700. The other thing that would have been repealed is the definition of essential benefits and preventive care. What this would mean is that the states would have control over what benefits health insurers would have to cover in their policies. This was a concession that congressional Republicans and the White House made to garner the Freedom Caucus Republicans' support for the AHCA. It didn't work, but the point is that Ryan, McConnell, and President Trump were willing to concede this point, and it was a huge point of concession. Let's take a look at these 10 essential benefits that the Republicans were willing to write off in order to get votes for the AHCA. It included ambulatory or outpatient care, emergency services, hospitalization, maternity care, including prenatal and newborn care, which is huge because prior to the passage of the ACA, 64% of the policies sold on the individual market did not include this coverage. Okay, so what else? We've got mental health and substance abuse, prescription drugs, rehabilitation and habilitative services and devices, preventive and wellness care, including chronic disease management, and pediatric care. The Republican leadership and the administration were willing to allow insurance companies to sell policies that don't cover any one or more of these types of care, and to allow them to call what they're selling health insurance. Seriously? One commentator has accurately labeled this type of policy as garbage care. So now that we've examined what mandates and regulations the AHCA would have eliminated, in the name of consumer choice and lower premiums. Let's look at those advanceable, refundable monthly tax credits Paul Ryan is so proud of. And I'm being kind of snarky here because the ACA used the same mechanism, and when they did, Paul Ryan and everybody else had a fit. The difference between the ACA tax credits and the AHCA tax credits is that the amount of the ACA tax credits is calculated on a sliding scale based on a person's income level, while the AHCA would have provided a flat tax credit amount based on a person's age. And there would be no reduction or phase out of the credits unless and until a person's earned income reached the $75,000 level. The impact of this tax credit scheme would have been enormously regressive, and it would have hit low-income older Americans the hardest. This Congressional Budget Office chart compares the impacts of the ACA and AHCA on young, middle-aged, and older Americans' ability to buy health insurance. It reflects the combined effects of the AHCA's generally smaller, age-based tax credits and higher age-rated premiums on the cost of health coverage as a percentage of income. The box in the upper right reflects the CBO's finding that by 2026, a 64-year-old earning $26,500 per year would experience a health insurance premium increase of about 750%. Under the AHCA, they would have to pay $14,600 for health insurance. That's more than half of their gross income. Who could do that? Of course, they could apply for Medicaid. But let's look what would have happened to Medicaid if the AHCA had been passed. Currently, states run their own Medicaid programs and receive federal reimbursement for at least 50% of the actual costs of those programs. The AHCA would have replaced actual cost-based reimbursements with per capita block grants to the states. Those block grants would have been based on each state's actual Medicaid spending per recipient in 2016 and would have been adjusted over time by a factor derived from the Consumer Price Index for Medical Care, or CPIM. For whom would this have made Medicaid more sustainable? According to the CBO, this change would have made Medicaid less expensive for the federal government. Over 10 years, it would have reduced the federal government's direct spending on Medicaid reimbursements by $880 billion. It would also have made the amount of federal government spending on Medicaid more predictable, since its growth would be limited by the CPIM. And as the Congressional Budget Office notes, the CPIM grows at a substantially slower rate than the rate by which actual Medicare costs increase. But while Medicaid costs would be lower and more predictable for the federal government under the AHCA, the states would find themselves footing an ever-increasing share of their Medicaid bills, leaving them with only two alternatives: either limit or reduce their Medicaid coverage or raise state taxes. How would this make Medicaid more sustainable? Well, it wouldn't, as this chart shows. The largest group of newly uninsured individuals under the AHCA would be that huge deep coral streak you see of some 14 million people who would lose their Medicaid coverage. And here's the whole sorry picture of what the AHCA's impact on health care would be. According to the CBO, the rate of uninsured Americans under 65 would have almost doubled by 2026. An estimated 20 to 24 million people would have lost their ability to purchase health insurance, and with that, any meaningful access to health care over the next 10 years. You would think that the AHCA would have effected some enormous government savings that would justify all this pain and suffering, wouldn't you? But you'd be wrong, because the AHCA also repealed almost every revenue provision included in the ACA. The AHCA would have repealed excise taxes on people who don't buy insurance, employers who don't provide insurance, health insurers, pharmaceutical and medical device industries, and additional Medicare taxes on high earners. So according to the CBO, over the next 10 years, the AHCA would have saved the federal government a little over $1.2 trillion in direct spending on premium subsidies and Medicaid reimbursement, but it would have eliminated $883 billion in tax revenues. The net savings would have been $337 billion over 10 years. Now that sounds like a lot to you and me, but that's $33.7 billion a year, or only 5.5% of the 2016 federal deficit. And $337 billion isn't even 2% of the federal debt. So who would have benefited from the AHCA? As the last two charts show, Medicaid eligibles and low-income seniors would be the big losers. And the winners? Health insurers, pharmaceutical and medical device companies, and the top 5% of income earners. By the way, I was shocked to learn that to be in the top 5%, you only have to be earning $216,000 a year, which just really isn't very much. An Urban Institute study found that 70.6% of the tax cuts under the AHCA would go to individuals and households earning over $200,000 per year, and 46.2% of those benefits would go to individuals and households earning over $1 million per year. To put that in perspective, an annual income of $200,000 puts you in the top 6% of American earners. A mere $450,000 puts you in the top 1%. Meanwhile, the same study found that 3/4 of the benefit losses under the AHCA would be visited upon individuals and households earning less than $30,000 per year. The AHCA would have massively redistributed income from our neediest citizens to those at the top of the economic heap. So what are we to think of the AHCA? To me, it was the perfect trifecta of Republican policy goals. Deregulation, euphemistically referred to as mandate elimination. Entitlement reform that would have punished rather than helped people in need. And tax cuts to the top 10%. What could be better? But was it a health care bill? No. Now, I know you're probably wondering why I'm going on and on about the AHCA, because after all, that sucker is dead as a doornail, right? Well, yes and no. The congressional Republicans are already talking about trying again, and I think it's important that we be prepared for their efforts and that we draw helpful conclusions from the AHCA debacle, or debacle, depending on how you pronounce that. There are lessons for us to learn here. To me, personally, the biggest and most alarming takeaway from the AHCA was its blatant and brutal anti-Medicaid agenda. Elimination of the ACA Medicaid expansion would eliminate over 12 million people from Medicaid and CHIP programs in 32 states and the District of Columbia. And that doesn't include people who might be eliminated by future cuts in Medicaid programs under the block grant reimbursement system that AHCA would have created. In New York State alone, 1.9 million people could lose their Medicaid coverage. Somewhere between 63,000 and 70,000 of those people live in our 23rd congressional district, and over 7,800 of them live in Tompkins County. Do we want to see that many of our friends and neighbors lose their health insurance? New York State could, of course, choose to keep those people on Medicaid, but it would still lose tens of millions of dollars in federal Medicaid reimbursement. As a result, Governor Cuomo estimates that 33 nursing homes in our congressional district would lose over $35 million in funding, and that means lost jobs. Counties in New York 23rd would lose well over $9.5 million in reimbursement. And given New York's system of funding Medicaid, our counties would have to make that money up, at least half of it, by raising property taxes. That would raise our property taxes here in Tompkins County by about 2%. Can we afford that? And the AHCA didn't stop with Medicaid either. It would have repealed ACA Medicare taxes on high-income earners that were designed to extend the viability of Medicare Part A for several years. In my humble opinion, the AHCA was a first direct attack in what will be a long Republican war on our social safety net. And as this war continues, it behooves us to learn congressional Republican doublespeak. When we hear them uttering certain key words and phrases, our BS detectors should go off, and we should perk right up and get ready to resist. Those words and phrases are, we will increase flexibility, or increase choice, or foster competition. What that really means is we will deregulate the hell out of that sucker. We will empower people to make their own decisions really means we will allow the states and the insurance companies to decide. We will increase consumer choice and lower premiums really means we will repeal federal mandates and regulations. We will modernize it or make it more sustainable means we will cut federal funding for it. And we will empower consumers really means we will let you sink or swim in a free and totally unregulated market. And here's another lesson we need to remember. Why did the AHCA fail? Why did Paul Ryan have to pull that bill? Was it because all of our Democrats and progressives went to town meetings and screamed and yelled and called their congressmen and really tried to block the AHCA? Was it because the CBO analysis was so negative? Was it because Ryan couldn't get enough Republicans to vote for the bill? Was it because the bill had no natural constituency outside of Congress? Well, it was all of the above. The bottom line was that Ryan and the White House could not rally the Republican congressional troops. There's a Freedom Caucus of 15 Tea Party Republicans who simply wouldn't be satisfied with anything short of an outright repeal of the ACA. Then there were 10 fairly moderate Republicans who were appalled by the CBO analysis and the general popular protest against the AHCA. Finally, there were 8 Republicans who wouldn't vote for it for various reasons, including one guy who was not a member of the Freedom Caucus but just wanted to repeal the ACA. And the AHCA didn't have a large and influential constituency pushing for it either. The medical devices industry liked it, as did the U.S. Chamber of Commerce and the American Retail Association, but the American Hospital Association, the AMA, the American Heart Association, the American Cancer Society, the American Diabetes Association, the AARP, and governors, both Democratic and Republican, all opposed it vehemently. Even the American Health Insurance Providers, a trade group, sent a letter saying that the AHCA tax credits were insufficient to enable most people to buy health insurance, and expressing concern about the loss of Medicaid funds. They didn't outright oppose the bill, but they didn't support it either. So no one was paying good lobbying money to support the AHCA, and it failed. It doesn't mean that congressional Republicans won't try again. And then we have the administration, which has another strategy. On January 20th, the new president signed an executive order directing all federal agencies to minimize the unwarranted economic and regulatory burdens of the ACA pending repeal. Health and Human Services immediately all but stopped advertising for people to sign up by the January 31st deadline for a 2017 ACA plan. And the IRS announced that it would accept tax returns that did not report whether or not the filer had complied with the individual mandate. Would that explosion be the death spiral that Republicans love to talk about? Let me answer these questions in reverse order. First, there is no death spiral. Several analyses have determined that the substantial premium hikes we've seen over the past couple of years most likely represent a one-time price correction, probably related to the risk corridor problem that we discussed earlier. And as the CBO reports, despite those increases, despite Trump's campaign promise to repeal Obamacare on his very first day, and despite this administration's best efforts to derail 2017 enrollments, the enrollments through ACA exchanges have remained steady at over 9 million plans sold. The ACA depends on private health insurance. Private health insurers are profit-driven entities, and they're pretty greedy about it, too. The ACA actually had to limit their administrative costs and profits to 15% of the premiums they collect. A 2016 CBO study reported that the health insurance industry's profits, after administrative costs and salaries, were only 2% of their income, which doesn't sound like much, but remember, that's 2% of hundreds of billions in dollars. And remember that executive salaries are included in those administrative costs, and CEOs of large for-profit health insurance companies measure their salaries in millions and millions of dollars. Advertising is another major administrative cost, but the biggest cost is claims processing. And health insurance and companies are not the only ones who have claims processing costs. Doctors' offices, clinics, emergency rooms, and hospitals have claims processing costs too, and they're substantial. According to the Kaiser Family Foundation, billing and insurance-related expenses, or BIR, cost hospitals, physicians' practices, and clinics close to $500 billion a year. The Kaiser Family Foundation further estimates that at least 80% of these BIR expenses would be eliminated if we had a simpler, single-payer healthcare financing system. That's $400 billion a year that we could be spending on actual health care instead of medical billing. This chart illustrates the point pretty clearly. The for-profit health insurance system eats up close to 40 cents of every dollar that Americans spend on health care. And what's the consequence of that? Health care costs in America are significantly higher and have increased significantly faster than healthcare costs in any other developed country in the world, because they all have some form of universal healthcare system managed and or subsidized by their government, and we don't. Single payer is the only system that can actually control costs and maximize access to healthcare. If there's a silver lining in congressional Republicans' efforts to repeal the ACA, it's that people are starting to understand the inevitability of single payer. It may take a while to get us Medicare for all on a national basis, but we are moving steadily closer to passing single payer here in New York State. Our state assembly is about to pass the New York Health Act for the third year in a row, and we now lack only 2 state senators to move the bill to the floor. Wouldn't it be great if we could lead the way to a single-payer solution at the state level? So, as we move forward, my proposal is that we take a 3-pronged approach. First, we mobilize to defend our social safety net programs, Medicaid, Medicare, and Social Security. Secondly, we continue to defend the ACA. And thirdly, we support the New York Health Act and Medicare for all.